We're talking about Facelift Dentistry. She has an open bite, she has an underbite, and a crossbite. All three problems in one person, just to make life easy for the doctor. Her lower jaw is too far forward. Her face is too long on the lower face. It distorts the shape of her face. She's been in orthodontic treatment for 9 years. Frankly, she's sick of it. And the results of this functional and orthodontics has just left her in a bad position. I want you to see, this is her bite. She is biting her teeth together in that picture. Only the left side touches and only a few of the teeth touch. Her right side is wide open. She can't even make those teeth touch at all. Watch her video.
When I was younger, I had braces like most kids. The orthodontist that I had at the time extracted 4 bicuspid teeth, which was kind of standard practice, I think, at that time. Years later, I noticed that I was starting to clench and grind my teeth at night, and I would actually grind grooves in my retainers. My brother ended up seeing a functional orthodontist, and he said, well, maybe she can at least get it to where you're not grinding or clenching. So I saw her in like 2011, and she decided to expand my palate, and she said that was better than removing teeth, which I agreed with. But it ended up creating, you know, the original gaps where those teeth were. After that, I just really didn't have confidence as far as smiling, so I barely smiled, or when I do smile, I'm very conscious of the fact that I have gaps in my teeth. I have to wear this thing on the left side, which kind of helps me to bite down to be able to have contact on this side. So I have to wear that at night. And then just to keep my front teeth from moving and shifting around, I wear this little retainer thing, which doesn't even fit very well anymore, because if you don't wear it for a couple of days, your teeth shift. And then this is like a flipper, and it just makes it so that I don't have these gaps in my teeth that were taken out when I was a kid. I put that in. It's just been a hard road with all of this. So I'm just ready to find a solution once and for all and just be done with all of it. In the beginning, when I came in, I only had one side in the very back, 2 teeth touching, and that's about it. Now I can actually touch all my teeth together, which is really great. It feels good and it feels more normal. Before also I had all of these appliances that I was wearing, and it's really weird because before I eat I go to get my appliance and I realize I don't need it anymore, so I just have normal teeth again. So that's really cool. And then the retainer that I wear at night, it's so much less bulky. I notice I don't clench as much as I used to, so definitely an improvement that way.
We're talking about how the facelift dentistry method changes lives, gets her in the right jaw position, gets her facial proportioning balance, and much less head, neck tension and stress. She's biting her teeth together in both pictures. The teeth were built using Venlay restorations, but first we used jaw track to get the jaw position, then Venlay restorations to finish it. None of her teeth were ground down, no jaw surgery. So instead of having jaw surgery and years more of braces, she was done in a matter of 8 days. 2 4-day sessions separated by about 3 weeks. I want to talk about the facial proportioning here because she's biting her teeth together. She has an underbite, she has an open bite, and when you look at how long her face is and how forward her jawline is, look at the shape of her face now. This is a totally proportioned, well-balanced face. And this is where her jaw was always meant to be. This is not an artificial position. This isn't porcelain veneers where we're trying to do cosmetic camouflage. This isn't a facelift in a dental office where they claim they do this. Bottom line is, this is facelift dentistry. And using the technology and the sciences to it, we get this mid-face and lower face and upper face proportioned. We have the jaw in the right position. Look how it changed. The shape and the expression and her cheekbones, it has an impact on the entire face. Facelift dentistry is a comprehensive method of functionality, physicality, and aesthetics that are hard to believe that only dentistry was able to do this. My name is Dr. Sam Muslin. Thank you very much.